Good morning. I'm Elizabeth Thomas with InTouch Health, and I'd like to thank the American Academy of Pediatrics for inviting us to speak today. I'm going to talk about telemedicine solutions and how we're revolutionizing the delivery of care, not only in this country, but all over the world. InTouch Health is a manufacturer of telemedicine solutions, robotic telemedicine solutions. We are in over 450 hospitals worldwide. There are currently 10,000 clinical interactions that are taking place every quarter. Let me tell you a little bit about how the technology works. What you have is a laptop with our software. You connect with 3 simple clicks to the cloud, and you are actually beaming right into a robot which is living in your emergency department, in your ICU, wherever you need to visit patients. So you can see that my colleague Ilan here is on his laptop, and what he has done is beamed into the robot. Good morning, Ilan. How are you? Very well, thank you. Can you beam in on one of our attendees and maybe have a little chat with them out in the audience so they can understand what the experience is like? So you can see that what Ilan is doing is zooming in on the badge. You could be using this zooming application to look at anything. If you need to look at a patient's eye, you can look at pupillary reaction. Anything that you need to see, you could see just as if you were there in person. And again, the way the technology is working is that Ilan is logged into his laptop using our software, going through the cloud and into the robot where he's interacting with us just as if he were here in person. He could literally be anywhere in the world with his laptop and an internet connection and be providing care to patients as if he were there. The opportunity for you is twofold. One is to provide efficiencies within your own hospitals. So what we hear, particularly from pediatric intensivists, is that everything is fine when I'm in the hospital from 7 in the morning until 7 at night. But when I leave at the night or when I'm not there on weekends, we find that the quality of care tends to degrade or at a minimum becomes very variable. Using the InTouch Health RP7i robot, physicians can beam in from their home or from their office, do rounding, talk to patients' family, talk to nursing staff, deliver care exactly as if they were there in person. The second opportunity is that we see groups of physicians working together to build businesses where they are providing their services on nighttime, weekends into hospitals. So actually providing outreach from their office or from their institution into outlying hospitals. At InTouch Health, we're enabling the delivery of care anywhere in the world. In our country alone, about 70 million people live in healthcare shortage areas. If we assume, just for the sake of discussion, that a third of those are children, we have 23 to 25 million children living in shortage areas who are not getting services. With our technology, we can provide service to those children. We can provide the best care in the world as if they lived and were in any academic setting. One of the models that we see growing up is a HubSpoke model, where physicians from the academic or tertiary centers are actually reaching out into these rural areas and providing care where it's so desperately needed. Let me talk a little bit about a small hospital in Clearwater Valley, Idaho. It's a critical access hospital, and the CEO of this hospital was talking to me several months ago, and she told me, you can't imagine the difference in a patient. We got a pediatric patient come into the ED on 1 o'clock on a Friday night and they're suicidal. Getting a psychiatric consult can be the difference between saving that patient's life or not. The difficulty, of course, is that there are not a lot of psychiatrists in the rural areas, and particularly not in this rural area of Idaho. Well, using the technology from InTouch Health, the hospital contracted with a group of psychiatrists who provide both emergency care as well as clinic care and scheduled patient visits. In this hospital alone, they had over 1,200 pediatric consults in less than 1 year for 79 patients. 82% of these patients had never had a psychiatric consult in their life. And so they can draw a direct correlation between the use of our technology, the care that's delivered by psychiatrists, and the improvement of health of the members of their communities. In addition to getting the emergency care that the patients need, they're actually able to stay in their community and get ongoing care. So these are patients who previously would have had to travel several hours, be away from their home. A parent would have had to leave work, get in the car with the child, drive for 2 or 3 hours to Boise, get a consult, drive home, and come back again the next week. So you can see how difficult that is to provide ongoing care. What we do is bring care to the patient whenever it's needed and wherever it's needed from the person and the physician that they need to have the care provided. One of the things we get asked about a lot is how do patients react to our technology. And what I can tell you, but more importantly, what users of our technology can tell you, is that we have extremely high satisfaction rates. Over 94% of patients and patients' families are extremely satisfied because they see that their family, their loved one, is getting the care that they need, and that they're getting the care that they need in their community setting. We have studies that show that staff satisfaction has improved radically and staff turnover drops significantly because the staff on the ground believes that they are getting the backup that they need from the specialists. So they're getting specialized help that they need when they need it to help them deliver better care to their patients. Just to show you some of the patients, the hospitals that we're working with today, as I said, we're in over 450 hospitals. Our device was purpose-built for healthcare. Healthcare is all that we do. It's an FDA-cleared Class 2 device, which is now extremely important based on the new regulations that were promulgated by the FDA a few months ago, which required a Class 2 device for any time you're doing active patient monitoring. And since you're using our technology or any technology like this to deliver patient care, you are doing active patient monitoring. So I'd like to thank you again. Thank you to the Academy for inviting us. If there's any questions, I'd be happy to take any questions that you have.